Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Nigeria labour unions in different states across the country call on governments to address insecurity, road infrastructure, high cost of living, minimum wage, among others, in light of the impact of the coronavirus pandemic. Primary and secondary schools resume fully in Akwa Ibom and Enugu states with optimism over normalizing school academic calendar after months of lockdown. And according to Johns Hopkins University, world's coronavirus death toll nears 1 million, with the US, Brazil and India making up nearly half the total. As countries continue to open up their economy and some others modify their lockdown ease following newer cases, the world has registered over 33 million coronavirus cases. According to Johns Hopkins University Coronavirus Resource Center, the number of deaths is closing in to 1 million. Countries like the US, Brazil, India, Mexico and the UK are the top 5 countries with the highest deaths. Over the weekend, the WHO warned that the global coronavirus death toll could hit 2 million before any effective vaccine is widely used. Meanwhile, recoveries around the world is nearing 23 million. Over 5 million people have recovered in India, the highest in the world, followed by Brazil, with the US in third place. In Africa, data from the Africa Centers for Disease Control and Prevention shows that more than 35,000 people have died from COVID-19 complications since the first case was confirmed in Egypt. In Nigeria, the NCDC announced 126 new confirmed cases and 2 deaths in the country. The new cases were reported from 11 states and the Federal Capital Territory. Now, in Kaduna, the 4 samples which were registered last night returned positive out of 43 analyzed. The new cases are 1 each from Chukun, Sabongari and 2 from Kaduna South. Till date, our cases totally stand at 58,324. Now, even though the organised labour nationally has suspended its planned industrial action and nationwide protests over the hike in petrol pump price and electricity tariff for 2 weeks, across the country some state chapters are going ahead while others are shelving the planned protests. Those who have suspended the protests include Kwara State, whose labour leaders have given a 2-week ultimatum to the state government to implement the 30,000 naira minimum wage or face industrial action. Addressing journalists, the state chairman of the NLC, Issa Ore, says several efforts made to plead and convince the government to pay has not yielded results, thereby the ultimatum.
Failure of which we have no other option to embark on industrial action to the
Members had come out dressed up for a protest march with placards bearing various inscriptions, but were told to sheathe their swords. According to the secretary of the state chapter of the NLC, Mr. Saliu Mohammed, the protest would have still held despite the suspension of the strike, but the police had advised them to cancel it. In Ibadan, the Oyo State capital, the Joint Action Front, student unions, civil society organizations supported by the NLC-TUC leadership in Oyo State went ahead with a peaceful protest in Ibadan. In Edo State, it was a different ballgame as the TUC and NLC say it is not in agreement with the national body on the strike suspension. The unions began their protests on the streets of Benin City today amid concerns and the risk of COVID-19 as protesters paid little attention to social distancing.
No electricity in Edo, for information. There's no electricity in Edo where it's at the outpeak. Many people have parked their cars, so I can no longer go with their vehicle. We join taxis here and there. So the struggle, like the already said, they have suspended the strike for only 2 weeks. But I think they have made a grievous mistake. They would have come back to NEC to decide the next act of action, they hurriedly went into negotiation to call off the strike. I think those people are not too happy. We are not happy. Leadership, are we happy? No! Leadership, are we happy?
No! This was not what the founding fathers of Labour bargained for. That Labour had degenerated to this extent, and I really did not know how we degenerated to this extent. We were supposed to be the voice of the common man in the street. We were supposed to be a voice to reckon with. We are supposed to be a voice government will reckon with. As I speak with you today, Igige has continued to make fool of us because we've not been able to hold our onions. As I speak with you, there's no equal and opposite reaction to what the government is doing. I bet you, in every situation, if there's no equal and opposite reaction, things will always go like this. We cannot continue to suffer this way just for 30,000 naira.
The major issue is privatization. When they privatized electricity supply, that's when our problems started.
Schools in Akwa Ibom State finally reopened for academic activities today after more than 5 months of inactivity occasioned by the novel COVID-19 pandemic. Students and teachers expressed their excitement about the development on the first day of resumption.
As far as I'm concerned, I can say we are 100% ready for the resumption of students coming back to school and all that, following the COVID-19, directives on keeping the kids safe and all that. We had training for the teachers in how to handle the students when they come back to school. We made sure we put a lot of things in place like outlets for washing of our hands, sanitizers and all that.
We have that exciting feeling having our students back to school. Yes, some of them were actually so happy to see the teachers coming in, and we, the teachers, are also happy having them back.
I feel very, very excited to come back to school after a very, very long time. I think I've missed so much, and I think that with the way the school is going, I think we're going to catch up with time, and very, very happy to be in school.
Well, private and public primary and secondary schools resumed across the 17 local government areas of Enugu State after months of compulsory lockdown. The leadership of both the public and private schools in the state say resumption is, however, timely to enable them make up for the time schools were not in session. According to the Commissioner for Education, Professor Uche Eze, the government has released adjusted school calendar, which will hopefully normalize the initial school calendars after 9 months.
What we are starting off now is the third term because we believe that these students will be better off if we expose them to the content of the third term curriculum before we promote them. So we will take 9 months to cover the lost ground for third term. Early December, we are going to start our first term, and we have planned the academic calendar in such a way that by 14th August 2021, we will end the 2020-2021 academic session. If we are able to achieve that, we normalize the academic calendar and things will flow the way it has been.
Like this infrared, we supplied it to the whole private school in Enugu State. We also got face shield. Every school branded theirs. We made all this campaign. We also went further to ask schools to do something like a reservoir. If you look at there, my own, I have to service my own. I fetched all the water into that reservoir. The overhead tank is there. This we did. We encouraged almost all the private schools to do in Enugu State.
More about flattening the coronavirus curve. Joining us from our Abuja studio is Professor Ihimario Ogumbo. He is a senior epidemiology advisor to the DG and CDC and lead epidemiological studies working group and co-chair scientific advisory group Nigeria COVID-19 Research Consortium. Thank you for joining us on the program.
Thank you. Good evening, Millicent, and good evening, listeners. Thank you.
All right. First, I'd like to find out from you how much data and science is guiding the response to COVID-19 in Nigeria.
Yeah, thanks for that, Millicent. At the very heart of our response has been data and science indeed. Right from the first case being confirmed in Nigeria in February, we have been monitoring the situation and collecting data on a daily basis and tracking the epidemic. All of our responses have been informed by, to a big extent, what's been emanating from the data. A few clips you had just before the show gave the current status. Its updates were given to Nigerians, and its updates we forward on to the regional groupings like the Africa Center for Disease Control, the World Health Organization, and they all add up to the global reports. It's a novel condition, and we're learning constantly about it. The science is very much at its infancy, but we're getting new and emerging information that is driving much of the actions we're putting in place. So to a big extent, and at the heart of our response is definitely the role of data and science.
Right, in the last couple of days, the NCDC is asking residents of Enugu, Gombe, Nasarawa states to take part in the COVID-19 household seroprevalence surveys to inform the ongoing public health research. Why those selected states of all the others?
Right. Again, thanks for that, Millicent. The idea is we want to get a better impression on the extent of spread of infection of COVID-19. Now, ideally, we would very much like to conduct the survey in every single state. But, you know, logistically, that's not always possible to roll out. So what we do, which is very scientifically principled, is to take a sample of the states. Our idea is to be able to have done the survey across every geopolitical zone of the country. But for now, we've started in 4 states, in Lagos State, in Gombe, in Nasarawa, and in Enugu states. And the idea is we could cascade going forward, having started with these states as a base. The states we've chosen are actually also quite strategic. We've seen from our routine surveillance system the high number of cases in Lagos. And that really gives us a good platform to learn a lot about the true extent of infection in the population. And as we do in more states that have relatively lower rates from our surveillance system, we can really compare and see just how much off the cuff the routine surveillance has been telling us exactly what is happening in the population.
So for some of the particular households NCDC will be visiting, how do you choose? And do you think that the people in those states have sufficient awareness on why this data is being collected? I mean, because samples will also be taken as well.
Absolutely. Millicent, and this one, I'm very pleased to be on your show to put the word out there and even increase the awareness around things. So the idea really is from the National Population Commission, we've been able to map out our entire country. And across the country, in the selected states we've now taken, we were able to develop what we call enumeration areas. In each of the states, we're taking about 34 enumeration areas, which is a cluster of several households. Now, within those 34 enumeration areas, we go further and take 20 households each. It's a fairly random process so that households have a fairly equal chance of having been selected. And once we get to a household, everybody in the household is eligible to participate in the survey. So those who would consent and are available to participate would have a nasal sample taken as well as blood samples taken. We combine that with a very short interview, and that gives us very rich information about what's happening across the communities in which these households are based.
If you can, in just a few seconds, I mean, are there countries who have conducted the same surveys, and how has that information aided the response? Just a few seconds.
And that's really great. Yes, a number of countries have, predominantly high-income countries. In the U.S., as far back as April, they began in California and in a number of other states, New York too. They had a number of the surveys that already told at that time that, you know, the real scale of infection was much higher than what their testing rates were. And Switzerland has done surveys, and many of our Nordic countries and the Scandinavian countries have done surveys. In Africa, many of our countries are only now embarking on surveys. The one that stands out, though, is in Kenya. But what they did in Kenya was, because they had a good blood bank system, they used residual samples from the blood donations that people gave. And that informed them very much. It told them that whereas they were thinking the prevalence was about 1% or less, it was nationally as high as 5.6%. And in some counties, like in Nairobi and Mombasa, it was in the top 8, 9, 10%. And so I mean, it's a very different intervention you need when you're dealing with an infection that affects just 1% of the population compared to one that affects 10%. So it's really instructive and truly informs the response.
We appreciate your time. We continue to follow the developments. We'd like to thank you, Professor Himario Igumbo, Senior Epidemiology Advisor to the DG NCDC. Thank you for joining us on the program.
Thank you. It's been my pleasure.
We have more on the COVID-19 updates when we return. To stay with us. Welcome back. The federal government, through the National Commission for Refugees, Migrants and Internally Displaced Persons, has donated food and non-food items to IDPs, physically challenged persons affected by the coronavirus pandemic in Yobe State. Flagging off the distribution in Damaturu, the state capital, the federal commissioner of the commission represented explains how the gesture will mitigate some of the challenges faced by the vulnerable individuals in the state.
The National Commission for Refugees, Migrants and Internally Displaced Persons is a federal government commission that is mandated to provide care and maintenance as well as durable solutions to displaced persons and other persons of concern. We are targeting at least 1,000 households, about 1,000 households. We're able to reach 200 households within Damaturu, and we're going to look at other vulnerable LGAs that have been most affected by insurgency and have a large number of displaced persons. So in the next few days, we're also going to go into some of the local governments to provide support.
We are happy they have keyed into the priority of His Excellency, and we assure them that, as directed by His Excellency, our distribution in Yobe is to reach beneficiaries directly and hand-to-hand. The items will be distributed cut across some locations, including medical consumables to primary healthcare centers, dry season farming implements in some locations, food and non-food items, dignity kit to pregnant mothers, and what. So we are grateful, and we hope this collaboration with the state will continue to reach more vulnerable population, and we assure the Commission that the beneficiaries will use the items for the intended purpose.
Managing the spread and prevention of the coronavirus pandemic has renewed the call for the payment of the new hazard allowance to all health workers. This is one of the many requests at the end of the 40th Annual General Meeting and Scientific Conference of the Nigerian Association of Resident Doctors.
The AGM noted that the state and government have put members in the state of tertiary health institutions, particularly APSUs, IMSUs, and LASUs. They do not observe irregular payment of salaries, shortfalls, and arrears of part salaries dating from 2014 of our members across the country. The AGM noted failure of some chief medical directors to implement the President Training Act of 2017. The AGM noted the commitment of federal government to have a collective bargaining agreement with the relevant stakeholders to determine the revised hazard allowance for health workers. The AGM demands that the state government to ensure full implementation of the Medical Resident Act of 2017 and ensure proper funding.
Dr. Seun Akinyemi is a public health physician. He joins us from Ibadan, the Oyo State capital, via Zoom. Thank you for joining us on the program. First, let's take a look at the total number of COVID-19 cases coming from the southwest. Almost 50% of Nigeria's cases are from there, and this is with regards to the higher number coming in from Lagos. But how would you rate the efforts of some of the other states like Oyo, Ogun, and Osun State in the pandemic fight? All right, it appears we've lost him. Hopefully, we'll try to get a hold of him. But let's tell you what's happening around the world. The world's coronavirus death toll is nearing 1 million. This is coming from Johns Hopkins University. But if we were to check worldometer.com, for example, that number has since surpassed. But it appears the United States, Brazil, India are making up nearly half of the total COVID-19 cases around the world. But the number is likely to be much higher, according to experts, as testing rates in many countries remain low, with virus-related deaths not being recorded. Here's more on the global update.
In India, novel coronavirus cases have tipped beyond 6 million as the country nears the peak period for Hindu religious festivals. The Southeast Asian country added 1 million cases in 11 days and is only second to the United States in total number of infections. India has seen just over 82,000 new infections in the last 24 hours. Despite President Emmanuel Macron's decision to shut down bars and restaurants in France's second largest city, Marseille, some restaurants remain open today. The government order came last week after Marseille and its surroundings on the Mediterranean were put on maximum alert level, as it's become the epicenter of the country's second wave of coronavirus infections. In Brussels, public transport workers have disrupted the network with a strike demanding employers take corona-proof actions for their employees. Many metro, bus and tram lines did not work as a result of the strike. Unions are also demanding an increase in allowance of pensions, unemployment and health. Finally, in Russia, the number of citizens getting a seasonal vaccination has significantly increased amid rising fears of a second wave of the coronavirus. Russia has been one of the countries at the forefront of finding a vaccine for the virus and has already begun delivering the first batch of its Sputnik V COVID-19 vaccine to Belarus for clinical trials.
Remember that a decline in the cases doesn't mean the curve has been flattened. Continue to take responsibility. For more information on the pandemic, you can visit our website. That's channelstv.com. There you see more updates. The top story there, Madrid widening restrictions. This is after 1 million people are now under partial lockdown as they're recording more cases. There's several other updates as well. India passing the 6 million COVID-19 cases, but it's also a country that is the topmost, that has the topmost figures and the number of those that have recovered from COVID-19. There's several other stories as well on our website. That's channelstv.com. Well, that's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay safe, stay healthy.